News Central now at this hour begins with security matters, where we understand that armed bandits have blocked the ever-busy Gusau-Funtua highway, kidnapping unspecified number of travelers. Yusuf Safi, a commuter who is still stranded around the area, told newsmen that the bandits stormed the highway in the early hours of Thursday and mounted a roadblock around the Tazaman axis of the road. According to him, the bandits in their large numbers, with about 50 motorcycles each carrying 3 persons, abducted an unspecified number of travelers. The Zamfara State Police Command spokesperson ASP Yazid Abubakar, when contacted, said that more troops, primarily members of the Nigerian Police Mobile Squad, had been sent to the impacted regions to clear the road when contacted. Still staying in Zamfara State, where youths and underage children say their illegal artisanal mining of gold is not stopping anytime soon, except the government attend to the current economic hardships and unemployment in the country. The illegal miners who spoke to News Central crew at the Chola mining site in Maru local government area of Zamfara complained of how insecurity have impoverished them, making them lose their sources of livelihoods and finding it hard to access jobs. Now, according to News Central's correspondent, most of the miners are underage, a child whose parents were killed by bandits in the region. Nigeria's Minister of Solid Minerals announced a clampdown on illegal miners across the country last year. We'll bring you the full part of that story in our subsequent bulletin. Now, moving to more stories away from security matters, let's now bring you updates on the End Bad Governance protesters facing treason charges. A youth rights campaign, YRC, has officially disassociated itself from the Russian flag displayed during the August 1st to 10th hashtag End Bad Governance in Nigeria protest. This follows the recent arrest of YRC National Coordinator Adara Moye, Michael Lenin, and Mosugu Sadiq by the Department of State Security and the National Intelligence Agency. At a Lagos press conference, YRC activists called for the immediate release of the detainees, emphasizing their lack of support for Russia and denying involvement with the Russian flag. National Secretary Francis Nwapa urged the government to release Sadiq, who is reported to be in poor health and urgently needs medical attention. Now we head to Borno State, where we understand that the catastrophic flood has displaced at least 414,000 people and claimed 30 lives. The disaster, triggered by the overflow of the Alau Dam after heavy rains, marks the city's worst flooding in 3 decades. The National Emergency Management Agency, NEMA, reports that over 23,000 households have been affected, with floodwaters inundating 70% of Maiduguri. Now, key locations, including the Shehu of Borno's Palace, the State Secretariat, and the University of Maiduguri Teaching Hospital, have been severely damaged. The flood also devastated the Sanda Karimi Park Zoo, wiping out 80% of its animals. Water levels have begun to recede, but the impact remains profound. Nigeria Governors Forum, led by its chairman Abdurrahman Abdurrazak, alongside Lagos Governor Babajide Sanwo-Olu and Ondo Governor Lucky Aiyedatiwa, visited Borno State to extend their condolences and support following a devastating flood that has displaced thousands of families. News Central's Umaru Kirawa reports that the delegation met with Borno State Governor Babangana Zulum and local officials to assess the damage and discuss immediate relief efforts.
Governor of Borno State, our brother, governors of Lagos State, Borno State, and distinguished senators, members of National Assembly here present. Well, we're here today on behalf of the Nigerian Governors Forum to commiserate with the government and the people of Borno State over the Alau Dam Bridge. Also to commend Mr. President for the quick reaction by dispatching the Vice President alongside him with NEMA and the Northeast Development Commission. On our part, the forum will do the needful to support our colleague. But from what we've seen in the media, it's truly a major disaster. in which we would also try to see ourselves. We know the hardship and challenges that people will go through, and we know also that His Excellency is up to the task in making sure he brings succor to the people and turn things around immediately, as soon as possible. We just pray for Allah's guidance in this process and wish the people of the state good tidings and pray for them. I know that strong challenges. People have been displaced from their homes, and we wish them well and continue to pray for them. Thank you very much. Welcome you to Maiduguri. And then we also, on behalf of the government and people of Borno State, convey a deep appreciation to the Nigerian Governors Forum, and in particular to this delegation for sympathizing with us over the flooding that has happened a few days ago. It is very devastating incidents because we have never witnessed such kind of flooding in the history of Borno State. We have some aged people in this town who are up to 95 years and they confess that they are.
And now to health matters. The Nigeria Center for Disease Control and Prevention has confirmed 8 new cases of Mpox in the country, with fresh cases recorded in Gombe, Plateau and Akwa Ibom State. So far, 67 cases have been confirmed in 23 states and the FCT out of 1,031 suspected cases from 35 states and the FCT. This was disclosed during a press briefing in Abuja organized by the Director General of NCDC, Jide Idris. On cholera, the agency said it has recorded 141 suspected cases and 1 death, with a case rate of 0.7% fatality in Katsina, Lagos, Kano, Jigawa and Adamawa State. Now, so far, 216 deaths have been recorded from a total of 7,663 suspected cases in the country. Now, to discuss this, we're joined by a public health expert, Dr. Matthew Oko. Thank you so much, Dr. Oko, for joining us.
Thank you very much. It's always a pleasure being with you.
A pleasure having you join us as well. Now, given the ongoing Mpox outbreak, what specific strategies can be implemented to prevent the further transmission and, of course, to ensure control of the spread of the disease in Nigeria?
Okay, so the first thing is, for people to be aware of, that we have this outbreak that is ongoing. And very importantly, people need to be able to identify this infection in individuals. And then they need to understand what the steps, that people need to take. As you know, this is a viral infection that is transmitted from, the interacting with animals that have been infected or eating poorly cooked animals. Again, we have human-to-human transmission by, very close contacts with the human, and as well as respiratory droplets, as I can see, including touching items that these people have touched. So if an individual who has contaminated surfaces or clothing, and then other people, gets to come in contact with these items as well, they run the risk of, becoming infected as well. So the very first is to be understanding that this disease is out there, and then understanding, one, how to identify it, and then 2, what they need to do if they have a loved one or a friend who has become infected, like I just explained. So understanding the different things, the different ways that it can be transmitted, helps you to take precaution and then prevent yourself from becoming infected. Then we have, on the larger scale, you have the government where this ailment is something that is vaccine preventable. So if we are able to roll out the vaccine, even though at the moment the recommendation is for people who have close contact with those who have been affected by this ailment. So vaccination can, play a big role in helping to keep this under check.
Now, what would you say are the most effective measures to mitigate the impact of the outbreak and prevent future outbreaks as well? I know that you've given some of it, but how can the government and health organizations ensure access to clean water, for example, and sanitation facilities in these affected areas?
Okay, so this ailment is, like you mentioned, is a disease of that has to do with hygiene, because proper handling of animals is one thing. Two, washing your hand with soap and water, and where you don't have soap and water, you can use sanitizer to wash your hand properly, and then maintain hygiene. With respect to access to clean water, again, that is something that is ongoing. It's a developmental issue that we need to, a structural issue that the government will need to look into. But as it concerns, this is more of a problem with cholera, like I did hear you mention in the course of this news. But with mpox, the strategy, right? What people need to know is to properly prepare the meal that they eat. That's when we talk about dealing with animals right now who that might be infected, and then preventing human-to-human transmission. So creating awareness is one good strategy, because if people know how they can protect themselves from this, then the chances that they're going to come down with it is very, very low. With the assumption or expectation that they will listen to the advice that the government and this agency has provided.
All right, still talking about public health infrastructure, how can Nigeria strengthen this area to better respond to and manage future outbreaks? What are some of the key investments that are needed to improve things like surveillance, diagnostic capacity, and emergency response capabilities as well?
Yeah, so unfortunately, Nigeria as a country have been in the response mode for quite some time. So it's time to move to what we call emergency preparedness, right? So, like you mentioned, which includes strengthening surveillance systems. So we have manpower needs, right? We have about data, right? Being able to transmit data from one place to the other is a very important factor. So there are people that we call disease notification or surveillance officers who are based in different areas within the country. So these people we need to have this people properly trained. We need to have these people be knowledgeable and know what to look out for, how, and we're working hand in hand with healthcare providers, because these people normally would present in the health facilities first of all. So high index training healthcare providers to have high index of suspicion, knowing what steps they need to take to define suspected case, quick transmission of information to the notification officer within the state, who also we need to do that up to the federal level, right? So these are some steps that that the government will need to take, in addition to strengthening the systems that are required in terms of data management. So surveillance is very, very important. It's very key in this process. So it is really very important to deal with the manpower need in respect to this, and then making sure that the facilities required to make this happen is available. Then, of course, we know all this will boil down to funding, right? So we keep talking about inadequacies in the budgets, particularly with respect to health budgets. We need to begin to look into that very seriously.
All right. Thank you so much, public health expert Dr. Matthew Oko. Thank you for joining us to discuss the outbreaks and, of course, how it can be curbed. You're still live with us on the news. We'll go on a short break now, and when we come back, more stories. Stay with us. Many thanks for staying with us. Now to politics. The Labour Party's National Working Committee, led by Julius Abure, has called for an investigation into alleged fund mismanagement involving Aisha Yesufu, Pastor Ito Aigodalu, Peter Obi, and Afenifere leaders. Now, at a press conference in Abeokuta, National Publicity Secretary Abayomi Arabambi accused Yesufu and others of misappropriating over 12 billion naira and $5 million from the 2023 presidential campaign. Arabambi also implicated Afenifere leaders in retaining over 600 million naira in private accounts. He dismissed Yusufu's denials and demanded a thorough probe into all related bank accounts. Meanwhile, Obedient Movement coordinator Dr. Yunisa Tanko dismissed the allegations as false, and Afenifere's deputy leader, Oba Oladipo Olaiton, has yet to comment. Now, the chairman of the Economic and Financial Crimes Commission, EFCC, Ola Olukoyede, announced that the commission will intensify monitoring of bank transactions to block funds from reaching criminals, including bandits and terrorists. Speaking at the 2024 annual Civil Military Conference in Abuja, Olukoyede linked corruption to insecurity, noting that corruption fuels poverty, which can lead to higher recruitment into criminal activities. Represented by Wilson Uwujaren, Olukoyede emphasized the need to address corruption to improve national security and development. Meanwhile, Minister of State for Police Affairs, Iman Ibrahim, called for a collective effort from all Nigerians to combat insecurity, urging everyone to work together with law enforcement agencies. Away from that now, a group of pensioners on the aegis of Abia Pensioners Forum has urged Governor Alex Oti to pay their gratuities and pension arrears purportedly written off by the government. A spokesperson and co-coordinator of the forum, Chukwemeka Okezie, at a press briefing, said that it was wrong for the government to enter into a memorandum of agreement with pensioners at a time they were most vulnerable. He accused the leadership of Nigeria Union of Pensioners in the state of compromise, saying it couldn't have negotiated their gratuity and pensions, which he said are personal. The forum therefore called on Governor Oti to rescind the memorandum of agreement and begin payment of the arrears in installments. In a quick response, Commissioner for Information in the state, Oke Kanu, said the pensioners ought to have channeled their complaints to the appropriate quarters.
On assumption of office, His Excellency started paying half pension. Even after the verification exercise of pensioners, this practice continued. Pensioners therefore started wondering how someone who promised to clear the arrears of pension could start piling up his own arrears. That was the first red flag to pensioners. Regrettably, the anticlimax of our expectation came in March 2024, when we started receiving alerts for the purported arrears of pension. Lo and behold, it became a case of total disappointment for most pensioners, especially those whose arrears ran up to 40, 50, or 60 months.
I hope this is not a dissident group within the Abia pensioners, okay, that's going to go and meet and they are talking of trying, in fact it sounds as if they are trying to blackmail government. Now, it's very unfortunate to hear this because they have channels to reach out to those who are responsible for issues concerning their welfare in government. So this group of people, I'm surprised to hear them talk about government not keeping to the terms of agreement that government have with pensioners, when ordinarily another group of pensioners are singing the praises of the governor and the government he leads, to the effect that this, the pensioners have been paid their arrears, and since April they've been receiving their full monthly.
You're still with us on the news, and what you see on your screen now are live views from Edo State, where the governorship election political parties are set to sign the peace accord. It's currently ongoing in Edo State, where the peace accord signing ceremony is taking place. And this, of course, is in the run-up to the elections that is coming up later this month, where Edo State will decide the new set of people who will be in power, The peace accord agreement, the signing ceremony is currently taking place in Edo State, and these are the live views. And to more stories now, smallholder women farmers in Abuja have criticized the Federal Capital Administration over its non-commitment to agriculture following a reduction in the agricultural budget for 2024 to less than 1% of its total budgetary expenditures. And while speaking to newsmen in Abuja, they say the allocation of less than 8% of the FCTA's 1.15 trillion naira budget is abysmal, poor, below the agreed 10% benchmark of Maputo Declaration for Agriculture, and will lead to higher food prices. They also urge the administration to allocate more resources to agricultural inputs so as to effectively tackle food shortages.
The 2024 total statutory appropriation of the FCT is 1.15 trillion. The allocation of agriculture and rural development secretariat of the approved appropriation is 7.9 billion, representing only 0.67%. This is relatively very poor and below the 10% benchmark of the Maputo Declaration, and show the non-commitment of the FCT to the development of agriculture sector.
There was an increase in allocation to agriculture input for 2024, which amounted to 710 billion naira compared to 2023 allocation of 101 billion 994,800. However, the allocation went majorly to fertilizer only, to the detriment of other inputs such as veterinary medicines and wares, improved seeds and seedling, respectively. The neglect of other agricultural inputs besides fertilizer in 2024 appropriation is likely to lead to higher food prices and food shortage, and could also impact livestock development in the FCT.
It was observed that the budgetary allocation to support the reduction of post-harvest loss was reduced with about 813,124,160 from 813,206,960 in 2023 to 82,800 million in 2024, which represents less than 1% of the previous year. This is despite the challenges of post-harvest losses being faced by smallholder farmers in the FCT.
We call on the Agricultural Secretariat of the FCT to allocate more resources for inputs such as seeding, livestock, fish, etc., other than fertilizers, to promote agricultural development at all its ramifications in FCT.
And back to health matters now. Parents, once burdened by the stigma and financial strain of caring for a child with a limb deformity, can now focus on building a brighter future for their loved ones. This was made possible by the Lagos State government's Limb Deformity Corrective Surgery program, which has continued to transform the lives of countless children born with congenital limb deformities. News Central's Ibalani Omoni reports.
A remarkable medical program is underway at the Bagada General Hospital in Lagos to transform the lives of individuals born with limb deformities. According to statistics, over 10,000 children in Lagos alone are living with limb deformities, while nationwide the number swells to a staggering 50,000. These congenital conditions such as clubfoot and bowed legs can severely impact a person's mobility, confidence and overall quality of life. But today, hope is on the horizon.
The procedure involves the surgeon cutting through the shin bone below the knee, amongst other procedures, and reshaping it to fix the alignment.
It's better off when they are still quite young. What I will advise that immediately they notice this, let them come to any of the 30 general hospitals. Come there. Of course, if they don't have orthopedics unit there, they will refer them Now, of course, for those that need immediate surgery, that will be done right there and then. But for those that can wait and they possibly don't have the money, then they can wait for this to be corrected for them, free of charge to them, everything.
Since its inception in 2007, this initiative has provided free corrective surgeries to hundreds of youngsters, restoring their mobility, confidence, and overall well-being.
So what we do is we collect lists from all our health facilities on people that have these lower limb deformities and are requiring surgery, and then we invite them for screening. And I just must point out that for some people it's one limb we're doing, for some people it's 2 limbs that we're doing. What we're looking at doing is over the next 3 years to do about 1,000 of these patients, and we're doing 50 in this batch today.
The Lagos state government speaks about more initiatives and its plan to improve access to healthcare.
Beyond the limb correction surgeries, we have eye surgeries that we do for corneal surgeries and then cataract surgeries as well. We have ear deformity surgeries that we do, as well as giving hearing aids to people. We do limb prosthesis as well.
It is important for us to create more channels for people to be able to access care. And we know how that today, more opportunities that can be created for people, the better for them. And because we're also looking at the long-term impact of this.
As the program continues to grow and expand its reach, hundreds more children are expected to benefit from these life-changing surgeries. In Lagos, for News Central, I am Igbalani Omoni.
Now, a recent study published in Public Health Action has shown the impact of the WHO-endorsed TrueNet system on TB and drug-resistant TB diagnosis in Nigeria, with implications for the global fight against tuberculosis. Developed and manufactured by India-based Mobile Diagnostics PVT Private Limited to aid in the diagnosis of tuberculosis and DRTB in remote settings at the periphery, TrueNet has reduced turnaround time for TB and DRTB diagnosis, increasing the overall case detection rate and fast-tracked treatment initiation, thereby cutting down the chain of transmission in the communities. And Nigeria has a high burden of TB and is among the 10 countries that collectively account for 75% of the global missing TB cases and 70% of missing DRTB cases. And one key reason for the country's low case detection rate has been limited access to rapid molecular testing facilities. Many thanks for staying with us. Now, before we went on the break, we were talking about the rampantness of tuberculosis, which is TB, and the fact that Nigeria has a high burden of it, with contributing to like 75% of the global cases that have been recorded so far. And one of the key reasons given for Nigeria's low case detection rate has been limited access to rapid molecular testing facilities. And now we want to find out why these cases are not detected on time, and some even go unnoticed. And to discuss this, we're joined by Sumit Mitra, the President, International Sales, Mobile Diagnostics Private Limited, and he joins us from Goa, India. Thank you so much, Sumit, for joining us. All right, Sumit, if you can hear me, can you provide us an overview of the TrueNet system and how this operates in diagnosing tuberculosis?
Thank you very much, Ibiza. Yes, indeed. Thanks for first having me on the call. The TrueNet is a very simplistic, complete start-to-finish solution endorsed by the WHO that has impacted a lot of countries, Nigeria included, in the fight against TB elimination. It consists of very lightweight, battery-powered, infrastructure-independent, 2 small machines that can report a TB specimen, whether it's sputum, bronchoalveolar lavage, or any other kind of specimen, within 60 minutes. The simplicity of the TrueNet or the TrueLab solution, of course, is embodied by the immense amount of science behind it. All these systems are completely connected, and as soon as a positive case is detected, they are immediately reported to the National TB Program's chain of reporting authority, so that right at the first point of patient contact. As soon as the diagnosis happens, the patient can be started on treatment.
Right. And what exactly inspired the Mobino diagnosis to implement the TrueNat system in Nigeria?
Let me respond to you in two ways. First of all, what kind of made us do what we do is because we come from India, and India as a country is resource limited and so on and so forth, and from the global south, etc. So we know the pain points of what it takes to access quality diagnostics. And our brothers and sisters in African countries are no less different, or they don't face any better situation that we do. Unfortunately, Nigeria also happens to be 5th in the line of 10 countries that is responsible for over 75% of the so-called missing million cases in tuberculosis that we have been talking about for years. And that is why under this USAID funded the introduction of New Tools project, Nigeria was one of the first recipients of the MolBio TrueNat solution. And we are very, very happy to have played a part in showing the world the impact of the TrueNat solution at the last mile, at the extreme peripheries, where there has always been a disconnect, where there has always been a lack of access to quality diagnostics and so forth. And I guess these are the very, very simple yet realistic reasons why the countries were chosen by the USAID, and Nigeria being one of them. And I am very happy to inform that MolBio is greatly, and it's full of gratitude to have played its part, and will continue to play a part in the years ahead.
All right, Summit Mitra, President, International Sales Mobile Diagnostics, thank you so much for joining us and shedding more light on the TrueNat system. Now to more stories. Nigeria's creative industry is poised for a breakthrough as stakeholders and government officials converge to address long-standing challenges and unlock the sector's vast economic potential. With Nollywood producing over 50 movies per week and Afrobeats dominating global charts, the industry's global impact is undeniable. But despite its success, funding, policy and infrastructure gaps have hindered its growth. News Central's Adeshewa Odushoga reports.
The Nigerian creative industry is experiencing unprecedented global success with notable achievement in music, film and fashion. Nollywood, the country's film industry, is now the second fastest growing movie industry worldwide, producing around 50 movies per week and generating approximately $600 million annually.
Because in front of all those artistic works.
For years, creatives in this sector have been advocating for government support to harness the industry's potential for economic growth, job creation, and cultural development. In response, the Federal Ministry of Art, Culture and Creative Economy convened a roundtable discussion with key stakeholders from the creative sector, including fashion, art and culture preservation.
What is available for them in the partnership is economic growth for their industry and their conglomerate as well. The partnerships that we are proposing is one that is going to be mutually beneficial, not only to the industry, to the country, and to the partners that we really bring on.
We built everything we did without money. Government never gave us money, they never gave us access, they never gave us anything. But I'm here telling you now, all of that is about to change. So government's role is to catalyze. It's not necessarily to be the front leader who can catalyze action and get the private sector to come in and really step in.
During the discussion, stakeholders highlighted crucial issues such as funding, clear policies and regulations, infrastructure and access to resources and technology.
I don't think anybody will question the viability of the entertainment industry and the creative sector in the industry. That is our new oil and gas. We've not actually been doing much about it. Everything that's happened in the creative sector has happened organically, without government support. So if we now have government support and it's genuine, and we can actually really put plans in place, you won't believe where we are going to go. Our music is all over the world. Our movie industry is #2 in the world without government support.
It is not just enough to pass through. It's more important to coordinate and ensure that this opportunity can generate income for the country, which is what everybody is now trying to do. Nigeria is broke. There's no hard and fast rule about it.
This landmark meeting is expected to mark a significant shift in Nigeria's creative sector, attracting increased investment and creating jobs for the country's rapidly growing young population. In Lagos, for News Central, Adeshewa Odushoga.
Now, the news continues in West Africa, where Senegal's President Bassirou Diomaye Faye has vowed to relentlessly track down migrant traffickers a day after news that at least 35 people had drowned off West Africa. Faye, elected in March, called on the country's young people to stay in Senegal rather than fall for the illusion of a better future elsewhere. He also adds that the government is working non-stop on policies to tackle youth unemployment in the country, and a hotline will be set up to which people can report the activities of such traffickers.
Avec une immense tristesse que je me tiens ici aujourd'hui, face à cette tragédie humaine qui nous bouleverse tous. La nation est en deuil et la situation est particulièrement insoutenable. Je voudrais, au nom de cette nation, la nation sénégalaise, présenter mes condoléances aux familles éplorées. Ce qui est arrivé ici à Mbour, qui est arrivé quelque peu partout sur les côtes du Sénégal, est le fait des filières de migration qui sont, il faut le dire, dans le trafic d'êtres humains, qui exploitent le désespoir de cette jeunesse et qui leur vendent le rêve d'un avenir meilleur. Mais je voudrais dire que la traque sans répit contre ces vendeurs d'illusions, ces vendeurs de la mort.
And now to business. Nigeria's import of premium motor spirit, PMS, commonly known as petrol, reached a record high of 3.2 trillion naira in the second quarter of 2024, constituting 25% of the country's total import. This represents a 100% increase compared to the same period in 2023, when petrol imports stood at 1.6 trillion naira. Cumulatively, Nigeria's petrol import bill in the first 6 months of 2024 reached 5.8 trillion naira, an 87.09% rise from 3.1 trillion naira recorded in the same period in 2023. The significant increase is attributed to high crude oil prices and the weakening of the Nigerian naira, which has depreciated by 44.43% against the US dollar since the start of the year. And this is despite the commencement of operations at the Dangote refinery in Lekki, Lagos, as the pricing of the refinery's products remain a point of contention with the Nigerian National Petroleum Company Limited, NNPCL. Still in business, the Development Bank of Southern Africa, DBSA, and the European Investment Bank, EIB, have approved a $220 million package to support the growth of South Africa's renewable energy sector. The EIB will provide $110 million, which is DBSA will match as part of their continued partnership to drive sustainable growth and energy resilience in the country. Now, the financing initiative is expected to produce 384 megawatts of renewable energy and is aligned with the Just Energy Transition Partnership, JETP, to support South Africa's decarbonization effort. It is also part of the European Union's Global Gateway external strategy for clean and sustainable infrastructure. And to sports now, Nigerian para-powerlifter Folashade Oluwafemiayo has confirmed the reward of $15,000 for winning gold at the just concluded 2024 Paris Paralympic Games. In an exclusive interview with News Central, the two-time gold medalist thanked the sports ministry for delivering on their promise. Her remarkable lift of 167 kg not only broke her previous world record in the women's 86 kg para-powerlifting category, but also made her the first para-athlete in history to achieve such a feat. It will be recalled the Nigeria Sports Minister, John Eno, promised a sum of $15,000 for gold medalists, silver $10,000 and bronze medalists $5,000 respectively. Folashade won gold in the same category at the 2020 Tokyo Paralympic Games. And that's all on the news at this hour. But before we go, let's take a look at our top stories. Now, we told you that bandits block Zamfara highway, abduct travelers. We also mentioned that National Emergency Management Agency says 1 million people affected, 414,000 displaced in Borno floods. And finally, we mentioned that Senegal President Diomaye Faye vows to hunt down migrant traffickers. Send your eyewitness report to the WhatsApp number on the screen. Also, do well to follow us on social media. We are at News Central TV. You can watch News Central live on DSTV channel 422, StarTimes channel 274, Avo TV, and YouTube. Many thanks for watching. I'm Blessings Mosugu.